First question. The feature that distinguishes herpes zoster from other vesiculobullous eruptions is its unilateral occurrence. Next, a 3-year-old child has a fever of 102 degree Fahrenheit and following upper respiratory tract infection, discrete vesicles and ulcers on the soft palate and pharynx are noted. The most probable diagnosis is herpes angina. Intranuclear inclusions detected during the course of herpes simplex virus infections are called as Lipschutz bodies. Next, Coxsackie virus causes herpes angina. Koplik spots is first manifestation but seldom seen. Recurrent ulcers occurring on the gingiva and palate are most probably herpes simplex. Which of the following is associated with the HIV infection? Hairy leukoplakia. Primary herpetic lesions involving the gingiva are most likely to occur during the ages of 1 to 5 years. Inflammation of the dorsal root ganglion and vesicular eruptions of the skin and mucous membrane in areas supplied by a sensory nerve that is affected is a characteristic of herpes zoster. Mumps is caused by paramyxovirus. Next, the reason why most patients suffering from recurrent herpes labialis rarely give a history of having acute form of the herpetic gingiva is because the primary infection was subclinical. In herpes, primary lesion is vesicle. Which of the following medications shortens the recovery period of the primary herpetic gingiva stomatitis? Acyclovir. Ramsay-Hunt syndrome, the cranial nerve involved is facial. All about herpes angina are false, except I am reading only the true statement. It may cause dysphagia. That's true. Herpetiform is vesicles which rupture and leave areas of superficial intraoral ulcers are caused by. The answer is actually none of the above. Okay. I'm just cancel that question and we go to the next question, that is prodromal symptoms precede 1 to 2 days before the onset of the diseases in viral fever. The commonest opportunistic infection in AIDS cases in India is tuberculosis. Which of the following is a difference between herpes angina and primary herpetic stomatitis? That is ulcers relationship seen on the anterior portion pillars. Next, cytological smear showing multinucleated giant cells, syncytium and ballooning degeneration of the nucleus is a characteristic of herpes simplex virus infection. Next, reactivation of the varicella virus in a posterior root ganglion results in herpes zoster. Next is shingles occurs is unilateral. Site specificity is seen in recurrent herpes labialis. Steroids are indicated in all of the following conditions: edema following extractions, TMJ arthritis, and angioneurotic edema. All these three steroids are indicated. Next, recurrent herpes occurs due to latent virus in the nerve ganglia. Next, acute herpetic gingiva stomatitis that occur in children and young adults. Drug used in case of herpetic lesions, acyclovir. A 40-year-old lady presents with unilateral dermatonic distribution of the vesicular eruptions associated with the severe pain. The most likely diagnosis is herpes zoster. Coxsackie virus is implicated in hand, mouth and foot disease. Next, which is best for diagnosis of primary herpes simplex infection? Fluorescent staining of the cytology smear. Next is herpes angina is caused by Coxsackie virus. Rubiola refers to measles. Which of the following is not true about primary HSV infection? Not true means it occurs as an epidemic. That means it does not occur as an epidemic. Okay. The true statements are primarily affects the anterior portion of the mouth, causes acute gingivitis and shows prodromal symptoms. The lesion, which is erythematous, recurrent and distributed along with the sensory nerve trunk is, it is herpes zoster. Next is herpes simplex is seen in less than 10 years of age. The virus which causes herpes zoster is same as that which causes chickenpox. Which virus given below is not a teratogenic virus? Measles is not a teratogenic virus. Okay. The teratogenic viruses include rubella, herpes simplex and cytomegaloviruses. Next question. The most common reported oral malignancy in HIV infection is Kaposi sarcoma. Next, in HIV, which cells are affected? CD4 cells are affected. Next question. A 60-year-old male presents with a 2-day history of severe left earache with a burning sensation in the ear and loss of taste, which is left-sided weakness of both upper and lower facial muscles. Facial sensation is normal. A few vesicles are seen in the pharynx. What is the most likely diagnosis? That is Ramsay-Hunt syndrome. Which of the following is not associated with the gingival lesions? So recurrent aphtha is not associated with the gingival lesions. Next is papillovesicular oral lesions are seen in herpangina. Which of the following does not cause oral cancer in children? Varicella zoster. Which of the following is a false regarding measles? Nikolke sign. The others are true about measles, that are Koplik spots, fever and malaise, and maculopapular skin rash. These are all seen in measles. Next, which of the following would be seen in late HIV cases? In HIV cases, we can see Kaposi sarcoma, oral hairy leukoplakia, gingivitis or pericoronitis. All of these are seen. Next, a 16-year-old female patient reported with a chief complaint of small ulcers on the cheek and tongue since 1 week. Mild rise in temperature was noted on the general examination. On an oral examination, multiple ulcers were noted on the buccal and labial mucosa. She also reported that she is having her board exams in a week. So, the questions are: 1. The most likely diagnosis is it is a tuberculoid ulcer. Second one, the probable etiology is it can be due to the emotional disturbances or vitamin deficiency or hormonal disturbances. All these three are correct answers. And third one, the management of such case would include: first one is symptomatic treatment followed by topical steroids and relaxation. Next question. True about HPV 6, 11, 16 and 18. A vaccine targeted against HPV types 6, 11, 16 and 18 has been introduced recently for the prevention of cervical cancer and genital wart. Next question is: Forshemer sign is seen in? It is seen in rubella. Next is Giemsia stain of biopsy shows enlarged macrophages with round organism. Clinical features include oral petechiae, hepatosplenomegaly with ascites, and the most likely diagnosis is infectious mononucleus. Next question is: herpetic paronychia is related to nail and finger.